Okay, here's our environmental check. All of the walls, your window, the table, the floor. Okay. All right. Okay, good. Okay, so let's start. Knock, knock, knock. Hello, my name is Nurse Susan. I will be assessing you today. Let me go ahead and just wash my hands real quick. Perfect. Do you mind if I check your bracelet? Okay. Can you confirm your name and your date of birth for me?
Carrie Lenhart, 6/29/57.
Perfect. Thank you. So today we are going to perform an assessment. It is going to be a head, eyes, ears, nose, and throat exam. Do you have any questions or concerns for your privacy?
No.
Okay, wonderful. Let me go ahead and close the privacy curtain for us, and then we can get started. So I'm just going to start by inspecting your head. It does look normocephalic. I'm looking for any lesions, masses, anything, any abnormalities. Let me go ahead and palpate. Again, feeling for any of those masses or any lesions. Everything does look good. So now we're going to move on to the eyes. So I'm just inspecting your eyes, the symmetry, to make sure everything looks good. Your eyebrows look good. Let me get in a little closer. Your sclera is white. I do not see any discharge, no redness, no swelling. I'm going to pull down on your conjunctiva. And I'm just again looking for that redness or discharge. It does look pink and moist, which is a good sign. So now I'm going to go ahead and use my pen light so that I can check for perla. So perla is going to be your pupils are equal, round, reactive to light, and they accommodate. Okay, so I'm just coming in from the side. Perfect. Good pupil constriction there. Good pupil constriction on that side. I would say your pupils are about a size 3, which is good. Let's see. So we're going to check for accommodation now. So if you could just look at my pen light and follow it. Perfect. Good accommodation. All right. So next, we are going to do the 6 cardinal directions of gaze. So follow my pen light. All right, good. Now the other side. Perfect. That looks good. So lastly, we would do a Snellen chart test. Since we do not have one, we won't be able to do that today. But if we did, I would ask you to stand 20 feet away from the chart. You would cover each eye separately and read off the smallest line to me that you can. Okay? All right, so let's move on from the eyes. We're gonna now check the ears. So let me just brush back your hair so that I can see your ears. Okay, everything looks good, symmetrical, the contour is great. Let me inspect them. Okay, I'm gonna palpate the pinna and the tragus. Push on your tragus. Do you feel any tenderness?
No.
How about on this side, any tenderness?
No.
Perfect. So I'm going to use my pen light to inspect. I'm looking for any lesions, masses, discharge. I'm looking for any excessive wax, which I do not see. Looking on the same here. Any excessive wax, discharge, or masses. No lesions. Perfect. So now we can go ahead and perform a hearing test. So I'm going to stand behind you and I'm going to whisper a word, and I would like you to repeat that word out loud.
13. 11.
Good. Perfect. So that concludes the ears. Next, we're going to go ahead and go to the nose. So I'm inspecting your nose for symmetry to make sure that it is midline. Okay, I'm going to look at it with my pen light inside. All right, make sure your septum is not deviated. There are no lesions, discharge, there's no redness. Everything looks good. The mucosa is pink. Okay, next we are going to check for your nares patency. So if you could just plug one nostril with a finger and blow out for me. Good. Now can you do the other one for me? Wonderful. So that's good airflow. So that completes the nose portion of this. After the nose, we are going to move on to the mouth and the throat. So I'm inspecting your lips. Make sure there's no cracks, there are no lesions, they are not dry, they do look pink and moist as they should. Can you smile for me, please? So now I'm just looking at your teeth to make sure that they are all intact. I see that your gums are pink, there are no lesions, there's no redness. I'm going to look inside your mouth now. Okay, I'm looking at the inside of the mucosa. Everything is pink. I do not see any lesions. I do not see any discharge or abnormalities. Your tongue is moist and pink. It is a little rough, which is good. I see your tonsils. They are pink. They are not enlarged. I see that your uvula is midline. Can you go ahead and say ah for me? Perfect. So your uvula moved with pronation, which is a good sign. All right. So that concludes the mouth and the throat section. Next, we are going to check your neck. So I'm just inspecting to make sure it is of normal contour. The trachea is midline. I'm going to go ahead and palpate so I can feel your trachea. Can you swallow for me, please? Okay, so I can feel your thyroid. It is not enlarged. Next, we're going to check your range of motion. So for this, can you please turn your head to the left? Turn your head to the right. Look up. Look down. Can you please rotate your neck? Wonderful. Okay, so your range of motion looks good. Let's test your strength. I'm just going to put my hand to the side of your head. Please push against it. Good. Other side. Good. Can you shrug your shoulders, please? Good. So I would say your strength is a 5+, which is very good. Next, we are going to move on to your lymph nodes. So I am checking for any swelling or any tenderness. I'm going to palpate and name each one. So as I am palpating, can you please just let me know if you feel any pain or discomfort? Okay. We are starting with your pre-auricular, your post-auricular, your tonsillar, your submandibular, your submental. Okay. Next, we are going to do your occipital, which is in the back, your posterior cervical, your anterior cervical, your deep cervical, which you usually cannot feel because it is deep, so that's good. That means it's not enlarged. Next, we're going to palpate your supraclavicular and your infraclavicular. Okay. Did you feel any tenderness?
No.
Good. All right. Well, that concludes our assessment. I'm going to go ahead and wash my hands. Here is your call light. Here is your personal belongings. Do you have any questions or concerns for me?
No.
Wonderful. All right. I'm going to go ahead and remove the privacy screen. Have a good day. Thank you.